be a useful hour, and thank you for your time and contributions. And I'm joined by a number of colleagues in the panel, Jenny Coles, who will be speaking in a minute, but also Sally Shearer, who is relatively new to the panel, comes from a health background, and Sally's involved in some of the other webinars and wanted to come along and join in today. And then also we have from the panel secretariat, Amina McKaylee, who's in the background there. So just a quick word about what we're talking about today. So this is the 2021 annual report, which was published later than we should have done. It's about, because we published it in very late December 2022. The reason for its lateness being primarily to do with the kind of the work that we were doing around the National Review into the circumstances of Arthur Lubinjo Hughes and Starr Hobson, and the other National Review about the children with disabilities and complex health needs who were in Hesley Doncaster settings. Next time we publish our 2022 review, we will be covering a 15-month period, and therefore will be much more in sync with the way annual reports work in terms of financial years. However, although this review doesn't take material from the national reviews that we did, clearly the themes that we will be talking about today have resonance with what we also found in those reviews. And the primary purpose of an annual report, apart from it being something that's required of us to publish an annual report every year, is to reflect on and analyse the themes that we are seeing, the evidence that we've seen through the 500 or so rapid reviews and local safeguarding practice reviews that we see every year as a panel. So in a sense, it's the work that you and your colleagues in safeguarding partner agencies across the country are producing, and then we aggregate that evidence and identify some of the kind of key themes. And some of the themes continue from year to year, and some of the themes we choose to give a bit more kind of focus on in a particular in an annual report, and that's certainly true of the themes that we'll be talking about today. Alongside this report, we also published, and if you haven't read it, I would really encourage you to do this. This is the analysis of the LCSPRs only that the University of East Anglia and the University of Birmingham did on our behalf. And that's got a lot of rich, deep detail about some of the themes and issues that they found when looking at the package of LCSPR's reports. And then, of course, around the time we published this, we published 2 practice guides on domestic abuse and bruising in non-mobile babies. We had a revised practice guidance, and alongside that, we published some examples of rapid reviews, which normally don't get into public domain, but which we felt was really important to share with colleagues in the sector. So that's the purpose of the session today. So I think we're going to go now to the slides. If we can go to the second slide, Steve, Jenny, there we are. So that's the plan for today, which, as you will see, got quite a lot to get through. Jenny's going to pick up and talk through the detail of the work that we have reported on in the annual report. Jenny was key working with a couple of other colleagues to the production of that report, so is best placed to talk through that. Next slide. Thank you. So that's just the kind of pen pictures really of the 10 members of the panel, and you will see some of those colleagues will be familiar to you. I think the important thing to say about the panel is that we are an independent body. We have our root in the in legislation and in the working together guidance, and it's about bringing together experts from across the multi-professional, multi-agency landscape that is responsible and has important contributions to make on in child protection and safeguarding work. So we're appointed as individuals. We don't represent any particular body, but everybody on the panel has got their kind of, roots back into a particular profession and a particular kind of organisational context. We reflect, I think, the diversity and sometimes the differences of perspectives that you will have working on the ground. And as such, we have many robust discussions. We don't always agree with one another, but what we try and do is use those discussions to kind of contribute to the knowledge and understanding that we have collectively about what's working and what's not working in terms of child protection and child safeguarding. So next slide just highlights the sort of roles we have. We have a role of oversight on the system, so we kind of quality assure, if you like, the system of national and local reviews and how well that system is operating. So one person once said we kind of mark the homework of local safeguarding partners when they undertake rapid reviews and safeguarding reviews through the feedback we give, although the responsibility for those reviews absolutely is with local safeguarding partners. But we can comment on how that system is working as well as what is happening in a particular area. And then secondly, and this is the most important role, is that through that process of having oversight on the system of reviews, we can identify trends, patterns, issues that are of national significance and importance. And we do that in part through the annual report, which you'll hear about in a moment. And then lastly, we have a system leadership working with others. So working with, AGCS, the College of Policing, National Police Chief Councils, NHS England, the Royal Colleges, all of whom have leadership roles in this space, but we are one of those partners and obviously have a particular role in giving voice to government, to different parts of government about what is working and what is not working. So that's the panel. And then I think I already sort of referenced most of this previously earlier on. This is the third annual report, and it intends to provide that window on the system and to identify some particular themes. So we picked out 6 themes, some of which are similar to last year, the 2020 report, some of which are slightly different, and provide some, I suppose, analysis about some of those stubborn challenges about information sharing, risk assessment, and so on. Also, and I should have mentioned this, there is the analysis which was published of safeguarding partners at yearly reports. And what we've said in that analysis is that, and it may be through the coming revision to working together, that we will have perhaps a better kind of idea together of what these reports should do. So these local safeguarding partner reports, some really interesting evidence in there, but we do think that they need to have a sharper focus on impact, evidence and learning. And then, sorry, because I can't, yes, so then thirdly is that UEA and University of Birmingham analysis of LCSPRs, which I think is really interesting in terms of some of the case studies that they provided, but also some of the comments they make about the timeliness and the quality of LCSPRs. And they have also given some kind of challenges back to the panel about what we might need to be doing in that space, and which we will be are responding to in terms of our role around improving the quality and consistency of LCSPRs. So that's me, and I'm now going to hand back and over to Jenny, who's going to talk through the key practice themes. Thank you.
Thanks very much, Annie, and really great to be here today. I saw on the participant list people that I certainly met and know, and really good to see such a range of people from safeguarding partnerships. So I'm going to pick up the key practice themes that came out of the annual review, and I think probably are still very relevant for this coming year as well. And I'm sure you think that as well. So just starting, the panel provides, as we've shown in our last year's annual report, a really good window on the system in terms of some of the 2021 figures. And in fact, I think Annie mentioned, we're hoping to enhance our analytical capability, certainly around the data, over the next 18 months. And I know that partnerships find this very useful. So here we've just picked out a few of the figures that have been around over the last year. So 379 serious incidents were notified to panel relating to 398 children. So a decrease on 2020. And although overall we're talking about small numbers, it's still a decrease on the previous year. A higher proportion of Black and mixed ethnicity children were involved in incidents reported to the panel compared to the 2011 census. Of course, we've had another census since then, and certainly we know, and we're particularly focusing on this year, looking at Black and mixed ethnicity children in terms of the incidents they're involved in and the reports that are written about them. 32% of children were under one, so still that vulnerability for the under ones, and I'll pick up that in some of the practice themes. And a really important figure, 325 additional children indirectly affected, so whether or not they were siblings or other members of the family. So, you know, a real need to look at the whole family and not just where the serious incident might have directly related to. Out of all those incidents, 156 were fatal incidents, and non-fatal physical abuse was the biggest category of serious harm, 36.8%. 132 families of children reported as open case to children's social care at the time of the serious incident, and 266 families were previously known to children's social care. 44 children were on a child protection plan at the time of that incident. So just finally picking up on one of the middle bubbles there, two largest age groups, infants under one, and talked about that vulnerability, but also an increasing 16 to 17-year-olds who make up 28%, and a considerable proportion of those were those that were caught up in either child sexual exploitation or broader criminal exploitation and youth violence. Okay, so I'm going to move on to the 6 key practice themes, and I'm sure that none of these will come as great surprise. However, what we have seen over this year is a greater complexity in some of the that was coming out in the LSCPRs that were completed. So first of all, critical thinking and professional challenge through effective leadership and culture, particularly that professional challenge and critical thinking. A whole family approach to risk assessment and support. And when we say whole family, you know, family members in terms of a broader extended family, but also individuals that go in and out of families. Central consideration of racial, ethnic and cultural identity and the impact that has on children and families' experience, and that intersectionality. And the panel are doing just beginning a major piece of work on this, which will be underpinning all that we do over the next year. The vulnerability of babies, domestic abuse and harm to children, and keeping a focus on risks outside of the family. So I'm just going to pick up a bit more detail on that. I'm not going to spend masses of time because it's a real opportunity for us to have our discussion, but just to give you a flavour of some of the things which came out in the annual report. So critical thinking and professional challenge. This very much focused also, LSCPRs also focused on leading across that multi-agency partnership and those boundaries. So, and absolutely included organisations that may see their primary focus as supporting adults. So leading across professional boundaries, even, you know, and leadership at every level. So whether or not that's individual practitioners on the front line, right up to senior managers, really key message, and the complexity of that. So, and also we particularly picked out the engagement of services with children and their families prior to this serious incident. So the following issues we thought were important to identify: the lack of frequency and quality of supervision by services for 268 cases, and that's services across the partnership. That's not one service in particular. We've put here poor escalation of concerns. There's something about effective escalation of concerns and encouraging a multi-agency discussion. So it's not just about escalating and then moving on. It's about using the systems are there to encourage multi-agency discussion if there's professional differences of opinion in particular. And then the particular lack of professional curiosity or failure to ask the second question, 290 of the total of 379 cases. So that's something we really need to work on to give people not only the confidence, but actually the information to be able to ask that second question. So important, and yet continually comes up, and far easier said than done, I have to say. So welcome some comments in the chat, and I can see they're coming through, and I can see the one about Think Family. I'm going to come to that in a minute. So, importance of a whole family approach to risk assessment and support. That whole family approach, so many rapid reviews and then moving on to the deeper LSCPRs, saw that as an absolute crucial aspect of risk assessment. So still seeing assessments done without all family members being involved. And you remember the panel's report around vulnerability of babies, under ones, and invisible men. Still very much an area that we all need to work on. And that's a very key theme that we see most weeks actually at panel in terms of LSCPRs. And the dynamics of family household and how that can bring vulnerabilities to children within the household. So just giving you some numbers there: weak risk assessment and decision making. Risk assessment so important in forming decision making going forward. Children indirectly affected by serious incidents. So, you know, it's all the children in the home, whatever their age. Absolutely. And their voice is really important, as we all know. So that integrated assessment, so of the whole family and all professionals involved in that family, bringing that information together. And then over-reliance on the ability of parents to keep children safe from harm. And I think that was particularly an area for young parents. And another area that we're seeing, mental health, drug and alcohol, always been there, but particularly around use of cannabis. And I know some local areas are looking at, in particular Kentar, you know, that is a regular thing and really worth looking at in some detail. And then, as I've said, all key members of the family involved. So that Think Family approach, we've got to work really hard on that. Consideration of racial, ethnic and cultural identity, really understanding their histories, racial, ethnic and cultural context, and what impact that might have. And here we've got some bullet points here. Few reviews demonstrate in-depth reflection about the influences of race, culture and ethnicity, and how access to support may have shaped families' actions or lack of access to support. And one particular area there is the importance of school part-time and full-time exclusions. Really key in that area. And if you read the annex to the annual report around the UEA research, that particularly focuses on this area and is really helpful. And as I said, a big focus for panel this year, and a specific piece of work that we're doing. Vulnerability of babies continues, and particularly around sleeping conditions and overlay. Still continuing to see that, and I know a number of partnerships are doing a lot of work around this. You know, really important to get families' views and how they interpret the advice that they're given. 84 LSCPRs published in 2021 related to 33 deaths, 39%, and 51 cases of serious harm. So, you know, still really important. And that work that was done on the myth of invisible men, very, very current still. Domestic abuse and harm to children, we've published our practice guidance around that. Domestic abuse, big feature, you know, 40% of cases. I'm sure you will recognise that in terms of your safeguarding partnerships. And we've published our briefing paper around that, particularly picking up the 4 care practice principles around being domestic abuse informed, trauma informed, intersectional, particularly in a whole areas that domestic abuse covers, and then that whole family approach. And what we know of is a real lack of research about what works in terms of domestic abuse and protecting children. So still a big area to cover, and I would challenge you all in your safeguarding partnerships around really scrutinising what are you doing around domestic abuse and implementing the Act. And as the analysis of the annual report showed, very few safeguarding partnerships have this as an area of priority. So risks outside of the family, some that I know safeguarding partnerships are still working hard on. Of those children notified to panel, 20 were victims of extrafamilial child sexual abuse or sexual exploitation, and 21 died. And there's real issues that we have to tackle around race and culture and Black boys in that area. That whole area of practitioners working with risk outside of the home, needing to access some of the other practice areas that we've looked at, high quality supervision and support, and particularly this area of seeing children and young people's presenting behaviours as a focus of their underlying need and vulnerability, rather than assuming that this is risk-taking behaviour. And still coming through in reviews, a focus on their behaviour and reactions to that, rather than really looking into the reasons for that behaviour and that vulnerability. So still an area that we're seeing, and the panel will continue to monitor that. So there's just given you a flavour of those 6 practice areas, and now's the opportunity for question and answer, which is the main part of the session. And I'm going to hand over to Steve now, who's going to help us through this.
Great. Thank you very much indeed, Jenny. So please, if you have a question, just either raise the hand, which is an icon in MS Teams, or just come off mute and speak, and I will try and manage that. Thank you to everybody who's contributed comments as we went through that presentation. Jenny, you did pick up on the Think Family element, which was noticed in the comments. Just to cover off the first couple of comments, there was a question or a reflection on the diversity of the panel. I don't know how you have managed the current ethnicity and diversity in the panel. Are there any plans to shift that in any way? I don't know whether Annie can answer that. Yes.
Shall I do that? Yes, and that is a kind of important point. The diversity of the panel was certainly improved after the last recruitment period. The panel are appointed through a public appointments process, and we need to go on working at that without any kind of question. And I think it's an aspect of our work, the panel's work, which also I think reflects some of the wider challenges in safeguarding partnerships and kind of leadership in organisations that have got responsibility for safeguarding and child protection. As Jenny indicated, we're actually just in the process now of scoping some detailed work around the issues about race, ethnicity, and child protection and safeguarding work. And I thought as well in the comments there were some questions about kind of language. And we know that this is something we've really got to kind of unpack and make sure that we've got we in the panel have got, we're using appropriate language, and that's based on, kind of good understanding about different concepts, their different meanings, but also about how biases can affect the panel's ways of seeing things, as well as, across the safeguarding system. So some really important issues there, without any question.
Yeah, excellent. Okay. Just for this section, we're going to continue recording, but then we're going to go into the forum questions in more depth, and we're going to turn off the recording. So just so everybody knows that. The other topics that came up were the comment number 24 was about the grandparents, the influence of the wider family. If you want to pick up on that. Also, this relationship between professional curiosity and the time given to that, and of course, those are two competing factors. Number 25 and 31 mentions that. 31 also goes into the fact that, of course, if you've got high proportions of agency staff working, then the continuation and the connection and the professional curiosity tends to be dampened by that. There was a comment about good quality supervision and role modeling. So that all these topics around the quality of care, the curiosity. Who wants to pick up on that? Jenny?
Yeah, I'm quite happy to do that. And that just brought, Steve, something to the quality of leadership and curiosity are really, really important, aren't they? And that modeling of curiosity, so people actually feel confident to be curious. And I think that links to what we were saying about escalation. But you can only be curious, it seems to me, as if you've got a whole, that you've got reliable information to help you be curious. And I think this very much links to information sharing, and professionals working together to make sure they're sharing their information as much as possible, because then you've got some information and understanding to know what sort of second questions to ask. And I'd be interested to know what people on the call think about that. I think these are all interlinked. We go on about professional curiosity. We've been doing that for quite a long while, but we have to question, what do people need to be able to be professionally curious and ask questions, and be confident in doing that, and confident in the knowledge that they have the information to ask those questions.
Yeah. Robin has made a comment in the MS Teams chat. Jenny, did intuition feature in any of these reviews, and how confident were professionals in listening to these cues? Any aspect of that in the review?
That's interesting. I talk about being put on the spot. I mean, intuition and professional curiosity are absolutely intrinsically linked. You could almost say they're the same thing. Yeah, gut instinct, I've just seen it. Gut instinct is so important. And, actually gut instinct is very similar to professional curiosity. Professional curiosity is probably just a nicer way of putting gut instinct. But again, I think you need to be confident, don't you, in your information to be able to ask questions, because we answer from that. And maybe, the other thing is that people needed to be supported through supervision, through their teams, to continually ask those questions. It needs to be become ingrained to give confidence.
Excellent. Thank you, Jenny. And Robin's apologising for putting you on the spot, but also saying that his research is focusing on teaching social workers to be more intuitive. But because the wider system seems to discourage this, so it's about everything you've talked about. So thank you, Robin. Good. Anybody else? Anybody want to come off mute and ask a question? There was a comment about the
Leah's put her hand up.
Oh, sorry. Leah. Yes, Leah, please. Over to you.
Oh, hi. I think there's lots of really good information on here, and I work in a joint partnership in the Northeast. It's just an observation, really. We are probably about 2.5 years now into the joint partnership, and there is a culture shift taking place and moving towards that sort of element of think family. But please, what I wanted to say was it's not easy. It's not easy given the current climate, the constraints, the resource kind of hindrances. It's not easy, but you know what I would say that we've observed initially when we wanted to become a joint partnership, the adult side were really worried that the children were way ahead of them and that, everything would be about the children, it wouldn't be about the adults. And actually, quite the reverse has happened. So there's been an awful lot of learning for the adults, and they've kind of learnt from the children's side, but then they've sort of forged ahead. So a lot of our work now, we've had lots and lots of safeguarding adult review referrals, but very few CSPR referrals for consideration. That's really interesting, but the message that kind of we're looking at the wider field, and on the adult side they're looking at the children and seeing what else they can do. It's kind of it is moving it, but it's not something that's just going to happen overnight, I don't think, in terms of think family. And I was a bit sort of disappointed that somebody had put in the chat around, they've got a case that's been referred in, that's kind of the suggestions around the think family, and yet people don't understand that. I think it's really important, certainly in our area, because of the issues that social care are having on the children's side in terms of where they can place people, the lack of foster carers. They are now having to go to a much, much wider family unit. So it might be, not just grandma and granddad, it's aunties, uncles, cousins, etc., etc., etc. And I think that in itself, given the issues we have around hidden males and all these other kind of hidden parts of the family, that just really supports the fact that we need to understand what think family means.
Thank you, Leah. Quick response, Jenny?
Yeah, I absolutely agree, Leah. And, we've been talking think family for the last 10, 15 years, haven't we? It does, one, it needs a lot of work, but it also probably needs, and as you've been saying, some actual structural change to bring stuff together. And I say that because I'm not a big, form follows function is where I come from. But the way things have developed over the last, and way services are commissioned in many ways, are not encouraging that think family approach. And so we've got to work really hard at it. It's not something that's, although people understand it, it's not something that's going to happen overnight. And yet LSCPRs, so many of them are very clear that this is an area that needs to improve, and it is a contributing factor to progress not being made.
Thank you. Yes, and we've certainly stimulated a conversation about professional curiosity and the overlap between that and the extension of bias that one might have, and the need for good quality supervision and so on. There is a question around this term multi-partner fertility and how this impacts on dynamics in families. And somebody's asking, is this a regular term used? Is that a term that we all understand, the multi-partner fertility, and how this impacts on the dynamics in families? It's comment number 37. And if the author would like to say more about that, then please help us out. But either put it in the forum, the MS Teams chat, or indeed come off mute and tell us more about that. Is it something to do with the complexity of families that Leah was talking about, and the fact that you might need to go into different areas, cousins, aunties, uncles, and so on, to find out more about the structure of the family and the complexity?
Hi, sorry, my name's Hajinder Gill. I'm the one who put the comment in there.
Oh, thank you.
Yes, no, sorry. I was just thinking about it when we were talking about think family and risk assessments and things like that. And it was just really, I think there's more research being done around it in America, but thinking about how when there is multiple partners in a family and how that impacts on the other supports that are there for the children. And I suppose it was just really promoting a discussion about that, really, to see how we can move forward, with our think family and risk assessment approaches of kind of interpreting that information a little bit more when it comes to safeguarding children. That's the only reason I kind of put it in there, really, just to stimulate discussion, really.
Great, thank you for that.
Thank you.
Good. So just a final chance to ask questions in this part of the process. Otherwise, we're going to begin to focus on the 6 themes and have a discussion around those more specifically. So just let me pause and give people chance. Great debate going on in the chat. Jenny, Annie, you may not have seen that in MS Teams yet, but of course that's all available afterwards. And some very specific requests, Jenny, to connect and work on the further research around some of these issues. Okay, so let me just pick up on this last one, number 54. The panel openly suggests that they themselves were unable to get both their AR published in a timely way due to national reviews. Linked to the 2 reviews were not completed within 6 months of the incidents. Many business units are juggling far more on a day-to-day basis. After that, my question is, what are the panel doing to look at the review and the compliance of partnerships against the Wood Review 21, suggesting the role of the business manager, hence the business unit, should be reviewed? Have all partnerships achieved this? Linked, do we know how many BM posts are vacant or temporary positions in England? So a question about timing and the complexity of the review process. Are you looking into that? Do you want to comment on that? Thank you, Annie.
Go this one? Yes, and the issue about timescales does come up through in a number of different forums. The rapid review requirement is one that's been set by panel, and the LCSPR requirement is one that's set in the kind of working together guidance. Now, of course, working together is being reviewed. I think it's unlikely that there will be much change in that in those. And in fact, what's quite interesting with the rapid reviews, and I think we said this in maybe in the annual report, can't remember where, there are quite a lot of reviews that come in on time, and some which, you know, sometimes for good reasons and sometimes perhaps less obviously good reasons, take much longer than the 15 days. And we have not seen that the ones that take longer being necessarily any better, because the whole point of a rapid review is to do just that, is to kind of look at what's happened and quite rapidly identify kind of learning and improvements, and also to decide whether or not to do a fuller, deeper review. I think we, and I can't remember the percentage rate of completion within 15 days or so, but it's quite high, impressively high actually. I think there's a bigger problem around the LCSPRs, and of course they do get waylaid by criminal prosecutions, care proceedings, etc., etc. And so sometimes there are kind of external reasons which get in the way of certainly being able to complete the review and to publish it. And I do think I think some safeguarding partners are, do this work really well and get things through, if not in 6 months, in 8 months. And that's impressive. When they go on for 2, 3, 4 years, and they do sometimes, we saw a couple last week when we met, you have a sense that the learning opportunity has just gone, it's dissipated, evaporated, and also things have moved on. So the ability of an LCSPR to really drive improvement, I think the longer that they take, the less that they have real purchase on changing things. So I'm sure it will get a look at, it will be reviewed in the revision of working together in terms of the timescales. I don't think as a panel, we think we're very minded to suggest major changes in the rapid review one, because we do think that a lot of them get through it in the time required and produce really good reviews. The role of business managers, I mean, that's not something we've got intelligence about in terms of posts that are filled or not filled. I think they're very, very pivotal, and we can see in terms of our relationships with safeguarding partners that, when there's a good, well-supported business manager function, it makes the work of the partnership so much more effective. And we know as well that some areas have got more rapid reviews and LCSPRs going on, and that must put enormous pressure on you. I think it's for the safeguarding partners to make sure that the right capacity is in place. And as you know, one of the recommendations in the Arthur Starr review, and I think this will be taken forward in the revision to working together, is having much more clarity about the responsibilities of safeguarding partners, and that will include the responsibilities and the resourcing and the capacity to make sure that the work that is required under statute is executed. A long
Thank you,
answer,
Annie.
but hopefully you
Thank you.
get
Yes,
key points.
long and absolutely complex answer. Thank you for that. So we're going to move on. I just want to raise the question that's arrived here, number 55. Perhaps I don't want to belittle the the work needed to get to this by asking for show of hands, but it might be interesting if you just put in to the chat if any local partnerships have achieved the child protection units recommended by the Starr and Arthur review. Just an indication of that would be interesting, or where you are on that timeline.
Actually, Steve, I think that's better asked to Annie or Jenny in terms of the
Okay.
government implementation strategy that recently came out.
Fine, okay.
In regards to children's social care reform.
Quick comment on that, Jenny?
Yeah, quickly, I know Annie will
Okay.
come in. So the implementation strategy on the independent care review of children's social care has only just come out, but in that they do talk about having pathfinder status for these. So so there hasn't been an expectation that partnerships get on and do this. The idea is to have a pathfinder program to look at the proof of concept. Annie, you might want to say a bit more about that. Although we know some areas, have been working on this area for some time.
Yeah, unmute myself. So the panel obviously is going to be involved and watching this kind of aspect of the implementation strategy very carefully. We hope and expect that those pathfinders will, in some places, really implement a really different kind of model about multi-agency child protection teams, units, call them what you want, because we believe from the evidence we have, as we set out in the Arthur and Starr report, believe that this is one design change that could make a real difference. We know it's not necessarily found favour with everybody, but we certainly remain convinced from the evidence that we see probably on a fortnightly basis that bringing people together around those core child protection functions in one integrated, co-located team could really pay dividends for children, and that's what we hope will be, really tested and evaluated, because there's different ways of doing that through the pathfinders. You're on mute, Steve.
I'm so sorry, I muted. So thank you for that. Thank you for the comments that are coming into the forum.